This is another one of my community service podcasts. For those who have not watched my podcast before, my name is Professor Ndubeze Okonkwo. I am a biochemist trained in forensic chemistry and graduate studies, a specialist in internal medicine, a subspecialist in nephrology, and also an ultrasound specialist in kidney and pancreas transplantation medicine. Today I want to talk about high blood pressure, aka hypertension. I'm trying to make it as basic as possible to see if I can help clear some of the confusion that exist in our communities. Untreated hypertension has devastating complications, most often than not leading to death if it's untreated. Hypertension, in summary, is the force that drives or pushes the blood coming out of the heart through all the blood vessels called the arteries to supply all the areas of the body, ranging from organs to the systems. If that force is higher than normal, it does cause complications such as damage to the brain, damage to the eye, damage to the heart, damage to the kidney, and other organs. If the blood pressure is low, it does something similar in terms of damage to your body because it will lead to severe hypotension, which will create a state of shock in your body if not corrected, meaning that your organs, your systems, your tissues, which means your body will not receive enough blood coming to it. And when the body does not receive enough blood coming to it, it is the blood that carries oxygen and the nutrients to bring them to every part of your body in order for the body to function. Because for your body to function, you need fuel, energy, just like you have for your car. So if you don't have nutrients, you're not going to be able to generate the energy your body requires to perform all of its functions. So hypertension, by definition, in general, is when the blood pressure, when measured, is more than or equal to 140 systolic blood pressure or diastolic blood pressure of 90 or greater than 90. Meaning when you check your blood pressure, the top one, if it's equal or more than 140, and or the bottom one being equal or more than 90, that is basic definition of hypertension. We have other classifications of hypertension, but we're going to concentrate on hypertension. At this point, not to worry about pre-hypertension. We can deal with that in another podcast. The next is what causes hypertension. We can make it very basic in saying that hypertension is classified into two different groups. There are other subgroups. What we call essential hypertension or primary hypertension. And then number two is what we call secondary hypertension. And the treatment for them can be different. So it's not one size fits all. Essential hypertension, we don't know with specificity to say this is specifically the cause of hypertension. That's why we call it either essential or someone can say idiopathic, but that's a big word. So say hypertension, we don't know the exact cause of primary hypertension or essential hypertension. But we do know that there are factors that are associated with it. Most importantly, what is involved in our diet. When one eats food that is rich in salt, it does increase your chance of having hypertension. The body has a way of dealing with excess salt until you overwhelm its capacity to do so, because if you eat too much salt, your kidney has the job of dumping the excess salt. But if it becomes more than manageable, then it becomes a problem to you. Then there are other things that will contribute to the development of hypertension. The way your blood vessel is made. For instance, somebody who is a smoker, smoking does stiffen up the blood vessels. And so the blood vessels' ability to expand or contract, depending on its environment, that capacity is decreased, because when the blood vessel is damaged by smoking, then it stiffens up. It's just like taking a balloon, and if you blow into the balloon, it will expand. But if you raise the balloon over water, over fire, and you blow into it, the balloon will not expand, and therefore its ability to contain the air coming in is decreased. The same thing happens to blood vessels. When the blood vessels are stiff, it becomes difficult for the blood vessels to expand when they are necessary in order to contain more volume of blood passing through it. The second type of hypertension is called secondary hypertension. And what it means is that you can pinpoint those things that are causing the hypertension. Some of them are either hormonal and some are structural, meaning certain hormones your body makes can create hypertension. And then some organs, when they are either bigger than normal, or the blood vessel shrinking in its capacity, or its the ability for it to let blood go through, can also make your blood pressure go up. An example of that is what we call renovascular hypertension. So the artery that supply the kidneys can develop area that is narrow, either coming from what we call thickening of the muscle, or the deposit of cholesterol and plaques in the same area, that can shrink the passage through which the blood goes, which is the lumen of the artery. And then when the kidney does not get enough blood coming to it, that kidney fails. So as we know, hypertension is one of the most common causes of kidney failure, but it doesn't cause it simply by this secondary kind of hypertension, because the most of the hypertension belong to the class of primary hypertension. And as we all know, that hypertension is a silent killer. It kills you gradually over time, and then when the person drops dead, people start wondering what happened. Was he sick or not? So it is essential for one to do your annual physical, depending on your age, or as many times as your doctor will prescribe to you or recommend to you. We do know that when the hypertension is not treated, it damages a lot of the organs. So it's a very serious cause of heart attack. So if your blood pressure is high and it is not treated, over time it's going to cause you to have heart attack, or it's going to cause you what is called cardiomyopathy. It's going to damage the muscle of the heart that naturally will function as a spring. If you stretch the spring and you let go, the spring will come back to its original position. If you continue to stretch the spring without stopping, eventually you go beyond its limit and it's not going to be able to come back. So the heart works that way. The muscle of the heart will expand and contract as it pushes the blood out of the heart when the heart beats. If the blood pressure for the heart to overcome when it pumps continues to be high, eventually the heart muscles are going to become weak. And when the heart muscles become weak, then the heart fails, and we call it heart failure. And that eventually will lead to death. So it is essential to make sure that one treats the blood pressure if you are diagnosed to have hypertension. You need to have it controlled. Kidney failure, and heart disease are two of the most common areas, as well as a stroke, where you will experience this devastating complication of untreated hypertension. So number 2 cause of kidney failure in the world, particularly United States, is hypertension. It's second to diabetes in causing the kidneys to fail. So if you have blood pressure and it's untreated, one way or the other is going to lead to one of these end organ damage. Either damage your kidney, have you to have stroke by damaging your brain, which is stroke. It's called a stroke. Stroke is another name for brain attack. And when it strikes your heart, it's called a heart attack. And then when it strikes your kidney over time, it may either come as a kidney attack, if you have hypertensive crisis, or is gradually going to kill your kidney cells, and eventually the kidney will fail. Hypertension, if it's untreated, can also cause you to lose your vision. Your eyes will be damaged. The part of your eyes called the retina, which is like the film you have in your camera, it's at the back of your eyes to help you see. The blood pressure can damage it. And when it does that, then the person goes blind. And there are many other complications of hypertension if it's untreated that involves many other organs. But I'm trying to make this as simple as possible. The next thing is if the blood pressure gets to a certain level, we call it a hypertensive crisis. So whenever your blood pressure is equal or more than 180, the top one, and or equal to 120, the bottom one, we call it a hypertensive crisis. We have other levels, but to make it simple, I won't be using expressions like accelerated hypertension or what we call hypertensive urgency and hypertensive emergency, because there are different levels of blood pressure measurement for different people and different age. What may be normal for a pregnant woman for hypertension, may not be acceptable blood pressure for somebody who is not pregnant, because when someone is pregnant, the blood pressure naturally lowers. And for an 80-year-old man, the blood pressure of a 70-year-old man, the blood pressure may be 140/90, and we may not be too concerned about that. However, when an 18-year-old has a blood pressure of 140/90, a 20-year-old, a 30-year-old, that's abnormal blood pressure we should be concerned about, and then initiate one modality of treatment or the other. Now that we know what hypertension is, how do we treat it? It is not one pill fit all. It is not one size fit all legs and all feet. There are different groups of medications that we can use for hypertension. But first, the number one way to treat high blood pressure, if it's not very high, is by using pharmacological treatment, such as exercise, diet, and by diet we mean to minimize salt in your diet and eat balanced diet, because there are vitamins and minerals that are involved in your food that will help the health of the entire body. But as we are dealing with hypertension, it deals with the arteries and the heart, and then the organs that they supply. So balanced diet and exercise, and making sure that the cholesterol in your food is not high, is one way to approach hypertension that is what I would call the stage 1 hypertension. and pre-hypertension, which is when the blood pressure is at about 140/90. You can try this modality first. But when you try it for about 3 months and you don't see any decrease in the blood pressure, and it's still hovering around there, then you should start treating the patient with medications. But of course, if you diagnose the blood pressure and it's high to a level where it's life-threatening and or damaging to the organs, you don't use diet is something you're going to add later on. The immediate thing to do is to give the person medication to drop the blood pressure, and then add these risk modifications, which is the things that make someone develop hypertension. You modify them, and I've just mentioned the exercise, diet, particularly obesity. Somebody who is obese needs to lose weight. It's part of the management of hypertension. In prescribing the medication, it's not one pill that you use to treat everybody. There is a tendency for people to say, my mother has hypertension and is taking medication A, therefore I have hypertension, that's what I'm going to take. Okay, that can be devastating because it can kill you. Because what is good for one patient may not be good for the other patient. And I'm going to give a couple of examples to illustrate the point. If somebody has diabetes and has hypertension at the same time, the medicine we would choose to treat that patient is going to be different from somebody who has hypertension but doesn't have diabetes. Or somebody who has diabetes, hypertension, and is a smoker and has a heart disease, such as narrowing of the blood vessels that supply the heart muscles, precipitating angina, which is the muscles are hungry because the muscles are not getting enough blood coming to it because of this narrowing. The medicine we're going to give him for high blood pressure, we may use it at the same time to help treat that heart condition. So, for instance, as a group of the medications we use for hypertension, we have one group that we call beta blockers. So if somebody is having a ischemic heart disease, or which means what I just described, the narrowing of the artery that supplies the blood to the muscles, and causing the person to have intermittent chest pains, we can give him medication we call beta blockers to slow down the heart rate so that the heart is not going to be pumping as fast as it should ordinarily. Because the more you pump, the higher the demand for nutrients that will be coming to the heart muscle from the blood. And if you're unable to deliver the blood to the heart muscles, then you're going to start having chest pain. So we can use beta blocker to treat that person. However, if somebody who has diabetes that uses insulin, who can become hypoglycemic, meaning developing low blood sugar, if you give the person beta blocker to treat the blood pressure that he has, when he's having a crisis from low blood sugar, he's not going to know, because that medicine is going to block the effect on the heart that the low blood sugar produces. So the patient may have low blood sugar and not know it because of this medicine you are using for hypertension. And then he may die from the low blood sugar. But you can give the same medicine to somebody who doesn't have diabetes and use it for hypertension, and it works very well, and the person has no complications. Another one is if we use another group of medicines called ACE inhibitors. Example of it is lisinopril. If we use lisinopril, it's more beneficial when you use it for someone who has diabetes, particularly one who has diabetes that is already showing evidence of secreting proteins into his urine and excreting them into the bladder. So when you recognize the person has this protein in the urine, we call proteinuria, you should put the person on this ACE inhibitor for high blood pressure. So while it's treating the blood pressure, it's equally treating the damage that the blood pressure causes to the kidney, which means it's treating the kidney damage at the same time that it's treating hypertension. So you will see that this medicine that is good for someone who has diabetes and hypertension at the same time is not necessarily a wonderful medicine to use on somebody who doesn't have diabetes, who simply has hypertension. It can be used on that person, but it may not be the best for him, depending on his other needs and his age and his race. Because there are medications that work best in black people, there are those that work best in white people, based on studies that have been done over the years. So there are, to summarize in terms of medicine, we have a couple of medicines and then we put them in groups. So I just mentioned the beta blockers, the one that slow down the heart rate. And then we have diuretics, the one that helps you urinate to decrease the volume of the blood in your blood vessels. Sometimes they work by that means, and other times there are other mechanisms by which they work. For instance, a diuretic we call thiazide. It doesn't treat hypertension simply by decreasing the volume of blood. There is a mechanism that it uses to create normalization of the blood pressure, which is not understood to science at this time, but it works. We know it works. There's another group that we call ACE receptor inhibitors. They are similar in function to ACE inhibitors. You can choose from there. Again, they can serve somebody with diabetes and hypertension at the same time. And the ACE inhibitors and ACE receptor inhibitors can treat the heart and treat the kidney and blood pressure, all three at the same time. So you will see that the way you choose and the reasons you choose the blood pressure medicine for one person may differ from the medicine you choose for another. We have calcium channel blockers, one of which common one is amlodipine, another is diltiazem or cardizem, another is verapamil. And these calcium channel blockers, they are good for people with heart disease. So you can use it for somebody who has irregular heartbeat, at the same time has hypertension. You can use that to treat both together. So the purpose of putting them in this group is to help the community understand that one medicine for blood pressure does not treat all people with blood pressure problems. For people who are pregnant, there are particular medications that work best in them. So we don't use the medicine we use for, most often than not, for pregnant women who have hypertension, and use it for somebody who is a female with with hypertension but is not pregnant, or a man. We can use medications like hydralazine and labetalol, calcium channel blockers for pregnant women. When in fact in non-pregnant women, there are other, we can use them, but they may not be the best for that particular patient. And then an elderly patient, the medication we're going to use may be different, because medications come with their side effects. So you want to use a medication whose side effect is going to be of benefit to the patient who is taking it. For instance, the side effect of taking a beta blocker is partly to slow down your heart rate. It's a complication. So if I don't need my heart rate slowed down, I don't want to take beta blocker for hypertension. But if somebody has tachycardia, which is high heart rate, regardless of what's causing it, and I want to bring it down, I can use beta blocker to treat his hypertension, while the same beta blocker treats that tachycardia. And so having said this, the next one is the secondary hypertension. The secondary hypertension is usually not successfully treated with medicine. In some cases, medicine will help. In other cases, you need surgery. For instance, somebody who has renovascular hypertension, meaning the artery that is supplying the kidney is narrowed at some point. If you're giving the patient medication for high blood pressure, in some cases, the pressure will never come down until you go and remove that narrowing. So that narrowing can be taken care of by putting a stent, like a plastic rod, to keep that area open wide enough that blood will be going through without interruption. That may solve the problem. And in other cases, you have to surgically go in there and resect that area. You cut the area that is narrowed, and then join the other end to end, and the problem goes away. In other cases, it is a gland in your body that is producing a certain kind of hormone, and that hormone causes your blood pressure to go up by the effect it has on your heart and your blood vessels. So if you recognize it, you go and remove that gland, and the problem goes away. A perfect example is a tumor that is called a pheochromocytoma, and it's found in the adrenal gland. Adrenal gland is a one small organ that sits on top of the kidney, and then it has so many functions, but we're going to leave all their functions for a different day. But one particular area of this adrenal gland can develop an overgrowth, causing what we call adenoma. So this adrenal gland has a tumor that secretes a particular hormone. This hormone is called adrenaline. The adrenaline is a common hormone that all of us have and use every day. When you see a lion walking down the street, then you have a need to run away. So your body will suddenly discharge adrenaline into your blood to make your heart beat fast enough so that you can run as fast as possible. That same adrenaline can be dangerous. If it's sustained, it can cause you to have a heart attack. And so we find this, sometimes I recently diagnosed a young woman who has been going from one ER to the other because when she develops these symptoms, sudden rapid heartbeat, sweating, and extreme blood pressure, hypertensive crisis, and then she's rushed to the hospital. By the time she gets there, they will check the blood pressure is normal. They examine her, she's normal, and they think it's in her head, and then she's discharged. So on this day, she shows up, and I happen to be on duty. And then they told me the story, which we call history, having realized that this has happened multiple times. So I pinpointed it that this is probably pheochromocytoma, this tumor I'm talking about. So I asked them to go and to the clinic of her choice, either to a nephrologist or endocrinologist, to determine. There is simple urine test that we do to detect the chemical in the urine and then confirm the diagnosis by imaging using scan. And then a surgeon goes in and removes the gland, and then the problem goes away. So you see that hypertension can be treated by surgery. And in this particular kind of hypertension called secondary hypertension, if you do not do the surgery, the blood pressure is not going away. The amount of medicine you give the individual is going to solve the problem. So you go to the root of the problem and take care of it, and then the problem is solved. So in summary, high blood pressure is a silent killer. It's not something that you're going to know that is affecting your organs until the damage is done. Therefore, you have to have annual checkups if you're a young person from at least 18 years to 30 years. And then after that, however number of times your physician recommends to you, you do so to make sure that if you have hypertension, if it's diagnosed, that you start the treatment in time to prevent it from damaging your organs. Because if you don't, eventually it will kill you, either a sudden death, or it's going to cause you end organ damage. Like I've explained before, your heart fails, you die, your kidneys fail, you die, you lose your vision, or you have stroke. And then the stroke devastates you because either you are paralyzed on one side, and other things such as you can't swallow because the muscles are no longer supplied by the nerves that come from your brain to do so. And then they have to put a tube in your stomach for you to eat. Or you can damage your bladder, and then you become incontinent. You can't hold your urine anymore. So every part of the body is affected by high blood pressure. So I recommend that you follow up with your physician and make sure you don't have hypertension. If you do, you need to have it treated, and you need to know what the normal blood pressure is, so that if you have high blood pressure, when someone is telling you don't, you will know that you do, because you can't wish it away. Again, this is a community service, and I recommend that you follow up with your physician and clarify everything I have said to be true, and then follow it up according to your desire. And hopefully this will reach many of our community members and prevent complications and sudden death that come from hypertension.